recommend Gardasil vaccine to young children?
I do recommend it. It is offered as early as 9 to 11. I offer it starting at 11 years of age, and I leave it up to the parents in order to decide, when exactly they want to have it. If you get the first shot by age 14, or younger, it's 2 vaccines. If it's 15 and older, it's 3 vaccines, 3 shots in the series. Definitely anything that prevents cancer, which this does, I'm all for, also as a cancer survivor, but just in general. And it is safe, and it is not linked to infertility.
So Dr. Butt, she did her BA from Wellesley College. She got her medical degree from Icahn School of Medicine. She did her MPH in Maternal and Child Health from New York Medical College. And then she did her residency at Maria Fareri in Valhalla in New York. And then she did a fellowship in Child Abuse Pediatrics in Children's Advocacy Center at Westchester Institute of Human Development. And now she runs the, do you run the team, Pediatric Integrated Trauma Team?
That was my previous job. Right now that was in my previous job. Yep.
Wow. Okay, so this is like years and years of training and everything. So tell me more about yourself first of all. Like, what made you who you are? Why did you decide to be a pediatrician? And then, what is this role of trauma in your career?
First, thank you so much for having me on. I'm so honored to be with you. You are an amazing woman, doctor, healer, and I so appreciate your energy and our friendship. So I'm so honored to be here. I want to say that first and foremost. So thank you. In terms of me, what made me want to be a pediatrician, most likely, as I look back, I've always been interested by kids. Even when I was a child, I would go and follow them. When we were at the Staten Island Mall shopping, I would follow the babies and get lost myself, lose where my mom was and stuff, because I was just so fascinated. But I think, honestly, what ultimately resonates so much with me is that I went through a childhood illness from the time I was 7 to 16, and really understand what that is. And I take those lessons, those experiences from when I was very young, having to be treated and apply them. It's fine. It was petit mal epilepsy, otherwise known as absence seizures. And so I was very lucky that, I was correctly diagnosed, and they were well controlled with medicine, but I had to take medicine many times a day, swallow horse pills as a 7-year-old, and then get EEGs and like all sorts of things as a young child. And I remember my dad took me to a neurologist somewhere in Manhattan. I'm not going to say what institution. And I was 7, and he was always about getting me the most, the best care I could. And this guy had done a lot of research in the field. So he brought me there, and after the visit, he asked me, "What'd you think of him, baby?" And I said, "I didn't like him." And he started laughing. He said, "How come? He's so well published. He's so well known in the field." I said, "Daddy, he didn't ask me a single question. I'm the patient." I was 7. So, children need to be seen. Children need to be asked questions. It's their bodies. I do that every patient I see. It's very important to me. And I've taught a lot of resident students over the years, and that is something that I have always communicated, that it's really important to connect with your patient. Your patient is the child.
I think we always keep a little part of that child. It remains through us, and the trauma that we suffer or go through, it just stays. Those are the misfunctions and dysfunctions that we have to heal ourselves from all our life. So Here you are, like I'm trying to imagine you're like it's a 7-year-old kid, and you meet this famous neurologist, and you say this person is not the right person because you didn't feel connected, you didn't feel heard and seen.
Yeah, he didn't ask me a single question. Talked to my dad the whole time.
I see.
Mm-hmm.
I see. He didn't want to like. What would this kid do?
Yeah.
So then, where did you go after that?
In terms of my care,
Yes.
I honestly don't remember. But, to my father's credit, my mother's credit, I was well looked after. Yeah. And so,
Your father was a famous doctor also.
yes.
But tell us more about what was that journey like? Because is that something that led you to become a pediatrician?
I mean, there's probably a lot of things, right? We're the sum of all of our experiences, and but that I think stands out, and it informs the way I practice. It informs the way I am a pediatrician today because it's very important to me to connect with my patients, and I ask them questions as well, and I teach everyone I can to do the same.
Nice. So, what questions should we ask children when we meet them?
Everything and anything. I mean, the question that a lot of kids get, I remember getting this question as a child too. It's like, what do you want to be when you grow up? And I'm like, that's the most boring question. Like, I don't know, and I don't even know what I want to eat for lunch later, But, when you ask, like, how has your summer been? And they went on some vacation, what did you think about it? What do you remember? What were your impressions about it? What was your peak of the trip? What was the pit of the trip? What's been your challenge? And I asked them, like, what's your peak of the year? What's the pit of the year? Like, what was your most challenging experience this year? Why was it challenging? Because those questions teach them some resilience also, right? So that they have the tools. I think that's kind of what the sum of my experiences in my profession and my personal journey as well has taught me is that with trauma informed care, as you were mentioning, what that is recognizing that we all have these experiences. We all have experiences that we must heal from, and we're dealing with in the context in the background. And as I was explaining, earlier, that it's basically a frame shift of, when someone is emotionally dysregulated or acting out in some way, that the question is not so much what's wrong with you, but it's what's happened to you, like what's going on, and how we can then sort of modify our reaction in that situation to be more compassionate, right? Because I think compassion is our superpower. And that's kind of what trauma informed care is. And we were screening some years ago for adverse childhood experiences. And that would be sort of a measure of that kind of trauma informed care and the kind of maybe support that a family or a child would need. The thing about that, though, is that once you've had those experiences, however far back they are, that score or that number doesn't necessarily go down, right? You carry them with you. What was more interesting to me, and where I think our focus should be, is the resilience building. That resilience is a learned skill. It's not, some people have it, we know those people, and some people have to work at it. And that's where we need to start, I think. And that's what I try to also do. And those questions that you ask kids in those simple interactions can start them to think about how resilient they actually are innately, and then draw on those experiences, hopefully, as life gets challenging, as it always does.
So when you say that adverse experiences, are there any experiences that we have to specifically look out for?
So that study, the adverse childhood experiences, that is a screen now that has been initially 10 experiences, including child physical abuse, neglect, sexual abuse, divorce or incarceration of a parent, drug use or substance use in the household. There were a lot of different things that were on that list initially, but that came out of a study back in the 90s. And that was done with Fareri and the two doctors who were involved with it in California and Kaiser Permanente. And they basically studied their patient population, which was mostly white middle class patients, and they surveyed them for these adverse childhood experiences. And what they found was very interesting, that one, that they were very common, and that there was sort of a dose response to the number of experiences that the patients had and then their current state of health and the number of serious chronic health conditions, including asthma and diabetes and those kinds of things. So we've known for some time that these experiences can impact our physical health. And we've always sort of made the connection between that and mental health. But we understand it so much more now, and it's a very important thing to consider when you're especially talking about the health of children, because that's where you can really impact the resilience building and hopefully the healing.
So what do you think is the role of a pediatrician in the maintenance and ongoing health of a child? Like, for instance, I know that insurances are so crazy and there has been so many issues. Do you guys have, like, I'm board certified in family medicine, and I did geriatrics for a very long time, and until I got into anti-aging, which is completely, out-of-pocket expense for everyone, because they just don't cover it. So what's going on with pediatrics? I mean, how many patients do you need to see? Doesn't the care get impacted by the load of patients that you take care of? And have you experienced, what is your experience?
Oh, that's a
Loaded question.
No, I mean, it's a great question. So I've been a pediatrician now for 17 years, which I can't believe I'm saying. But that's in part because of you. I first and foremost, I love what I do, and would choose to do it again and again and again. And even going through what we've just been through with this the pandemic, and how it's really impacted medicine and also the mental health and well-being of our whole community, not just the kids. I feel like there's always been a rush. Primary care is one of those things that are not as well, it's not as well reimbursed as it should be, because in this country, unfortunately, I don't believe we really do healthcare, we do sick care. And so if we really valued preventative medicine, we would really put a lot more stock in the primary care efforts that are going on. If we can prevent people from getting sick, we wouldn't have to spend so many healthcare dollars trying to get them better. And we started in childhood. That is really my mission. But it has always been sort of a race, like you want to see everybody, and you want to take the time that you need, and that's what a lot of us do, right? We take the time that we need, and then we do, we have pajama time where we're doing other things at home that, we don't turn off necessarily. But that's exactly the charts, the emails, the checking the labs, the phone calls, whatever it is. And that's, that's part of what we sign up for. I'm not complaining about that in any way, shape, or form. It's something that I've always known. I watched my dad do it for 40 years.
I won't complain about it because it's like it takes away so much time and so much energy, because a human being has only so much time.
Correct.
I always say that you want a doctor who has studied for 30 years and has 20 years of experience. You don't want that doctor to be not focused
100%
or the patient, and instead is like clicking and clicking and then clicking and
right.
taking notes because, oh God, I'm not going to get paid if I
right.
don't enter it into this machine.
Correct.
And hopefully ChatGPT from AI is going to resolve this at some point, because I feel that we all need like a scribe. We're going to the olden times where doctors used to go with a scribe.
Yeah, I mean, I think that there's always this push and pull, and we were talking a little bit about boundaries before too, and that is something that doctors are not expected to have. That like the number of times you go somewhere and someone's like, "Oh, you're a doctor. I have this," and you're just, "I'm not on right now," but you don't say that, right? You answer somebody's question, And boundaries are tough when you're a physician. And it's not like that for many other professions. Like you can't imagine a lawyer, it's a totally different dynamic, as it should be, honestly. But there's got to be a balance because the burnout is real. And with pandemic and with a lot of doctors leaving medicine and also leaving the area. I've had a lot of new patients every day, and I won't close my panel because I just, I believe healthcare is a human right, and I want to see the patients and meet them where they are. So, but it's tough. It's a tough balance, and no one's really talking about the crisis of not having enough doctors, and we don't. We really don't. So I hope that gets remedied somehow, but that's kind of the state of where we're at right now. And so you take the time that you need because that's why you do it.
What is your routine, like if you're performing like a trauma-informed care and you want to, like how much do you spend per patient and how many patients do you see in a day?
I see as many as need to be seen. Well, I work, I see patients from about 8:30, 8:45 to 4:45, 5 o'clock. And that doesn't mean that you're done at 5. But and I go in really early. My patients are used to me. My parents are used to me calling them at 7:30 in the morning to talk to them about their labs or whatever. Before they get on with their day, the kids go off to school. The parents are working, but it's also a good time for me before the chaos of the day ensues, and I, don't get a chance to call them about something. So, you put in a little extra hours, and on either side. But it is what it is. It's what it takes to do the job to your satisfaction, right? Because that's what it is. Like, I won't do this any other way. And when I can't do it the way I want to do it, then I can't do it anymore,
If I knew you when I was a child, I would come.
Oh.
Other than that, how do you think that if we find out that somebody had actually some form of trauma when they were younger, and that is leading to, and they're at risk of mental health, do you then send them, like, what is the next step for it? And how, when I used to do primary care, like 15 years ago, even to this day, I find it hard for people to find psychologists.
Oh my gosh, yeah.
Psychiatrists who would take their insurance. It is such a paucity of good people, who could help you. So what's going on with your panels?
So it just depends on what the need is, right? What the specific need is. And the other, just to finish the previous sort of thought, which was that now, because of pandemic, the number of children with anxiety disorders, depression, and eating disorders has been on the rise. And we don't have enough specialists to take care of it. We just don't. And to see everybody. So I do what needs to be done. Is I have the conversation. I figure out the referrals. We have, behavioral health is part of my organization that I work for now. So I make those referrals, but it is challenging. Certain insurances to find people who are taking new patients, period, who are accepting insurance, because many are doing it out of pocket. But then, who have that good combination of taking the insurance that your patient has and are accepting new patients is sometimes very challenging. But we do what we can. We try to advocate for our patients, and we try to get other supports in as much as possible, whatever the family dynamic is, whatever supports are needed. Zoom telehealth sessions have been actually, I think, a really good thing in a lot of ways. It's a weird thing to sort of get in. Sometimes when I bring it up, they're like, "Oh, that's strange. Shouldn't you be in the same?" It's like a very impersonal. But on the other hand, a lot of kids, especially, are so used to it with having gone to school that way that. And with the technology, and then sometimes it's easier for them to access because you don't have to worry about scheduling and getting out of work and picking up them from school, and it can be a little bit easier. So, anything that increases that access, I'm all for, and supporting the patients and their families. But that has been challenging. The access has been challenging, but that is often what it is. And trying to get the right, programs and the right, in terms of eating disorders, that can be challenging as well. Finding placement in certain programs and stuff, and support. But we do what we can.
How do you, so if somebody has like dietary issues and stuff, what do you do for them, like nutrition wise? If they have like, are there places that they can get it with it, or?
Yeah, and sometimes it's not necessarily an inpatient, it doesn't have to be inpatient. Sometimes it's a day program, sometimes it's an outpatient. But a multidisciplinary team is usually what it takes, right? So having like sometimes an adolescent medicine specialist and who's well versed in eating disorders, where they have a team which includes nutrition and all sorts of things, and then of course, mental health services, is part of it too, therapy, feeding therapy, and then also many programs will have sessions where it relates to the family dynamic too around meals, because sometimes that needs to be observed and sort of impacted as well, depending on the needs of the patient.
So what made you work in Yonkers? Like, I work in Yonkers because I trained there, and then I had like a patient panel there, and then when it came time to start an anti-aging center, I chose to be there because I really liked that area, and I thought I'm like very close between Manhattan and where I live, so I was like, I can, you know, a lot of my people could access me. I knew that Yonkers is like an area where there are not a lot of resources over there. It's like a kind of a left out town, even though it is like a very large.
City, yeah.
I feel that it does lack some very important resources. So, what made you work in Yonkers, and why do you still do it?
So I'm actually not in Yonkers anymore. I'm actually in White Plains now. It'll be a year in September that I moved out of Yonkers, but I was in Yonkers for 8, almost 9 years, between the two different jobs that I had. So I'm still close. I'm still close, but I love Yonkers, and I feel very committed and connected to that community, because while I was there, so in the job previously to where I am now, to the company that I work for now. It was an FQHC, a federally qualified health center, and that was so aligned with the mission of why I went into medicine, because I believe healthcare is a human right. It's why I did my master's in public health, to have a greater understanding of how to impact and improve the health of our communities. And I worked for that FQHC, loved the patients that I took care of. And also while I was there, worked at St. John's, Riverside Hospital there, and worked in the nursery there. Loved working there. And worked in the nursery there. Yeah, worked in the nursery there, loved the nurses there. They do such a great job. And so, I just really felt connected. And then I basically took this other position and was still in Yonkers, which was lovely. A lot of patients found me because they're like CIA, you know, and I'm so glad for that. You can't tell them where you're going, but they find you. And then I had to for the same company there was an opportunity to move over to White Plains and restart rounding the nursery. So now it's a different hospital that I round in, but that was a piece that was also missing for me. So now I'm able to do that in my current office. It's great. But a lot of patients still come to see me from wherever they can come to see me, wherever they're from, which is wonderful for me because I feel very connected to them.
That is so amazing. Listen, if children and parents of children are looking for you, that means you're the best doctor there is.
Oh,
I knew you the first time I met you. I was like, wow, this lady is totally different.
thank you.
That's such a great. So, tell me more about like what do you think is trauma? Like, what other things do you expect? Like trauma. Like, what is your personal experience with trauma? How would you deal with it? How have you suffered? Like, I have trauma that I'm still healing from. And sometimes I come across memories of childhood trauma that I'm like, wow, that was traumatic. And I have to align with it, face it.
And how do you do that? What is your process for healing?
I meditate, I talk to somebody about it. I have something that I personally like for myself. I like to journal it. I like to write it. Once I write it, it's off of my chest. Sometimes I burn it. but then sometimes I speak it to somebody because many times I feel that all our problems are kind of similar, and because when you have similar problems, a lot of people resonate with you, how you dealt with your problems. So um, I feel that that's how I sometimes cope. But do you have any impactful ways that you've thought of trauma? Because for me, like trauma leads to spilling cortisol, and then you are inflamed, and then you will develop some disease. That's what I feel. And
100%.
age faster. So, and for me, your health span and your beauty span is very much related. And because I joined the cause of beauty and cosmetics at some point, I was like, trauma is not great for beauty.
So yeah, I think absolutely. So I'll get into like trauma and what is a traumatic event, right? So it's subjective, right? Because not everyone experiences the same event. We know this from COVID. We know this from COVID. We've all gone through COVID. We've all gone through pandemic, but we've all experienced it differently and individually. There's some families where half of their family tree was decimated and wiped out from COVID. And there are other ones who feel like it was a cold and they were fine and they didn't understand why they had to stay home for so long, right? So like everyone experiences it so differently. So it's very subjective. So understanding what is traumatic has to do with what is traumatic to that individual. So, we all know that there's different levels of stress, right? There's kind of positive stress where you give a presentation and you're not a natural speaker and you get nervous and you're like, why do I do this to myself? Why do I agree to do this? Or you have to do it for work or school or whatever. That's a
Tough.
I know you did so amazing. Are you kidding me? You're natural, but it is. It's a positive stress. That's a really good example, right? Because it means something to you, so you want to do well, and it's a positive stress. Athletics, competition, that kind of thing, right? That's positive stress. A little bit of stress makes you perform a little bit better, right? And then there's a toxic level of stress, and that is where it ends up being traumatic for that individual, where the cortisol response does not go down. We're meant to have fight or flight response, right? That short burst of survival, sort of. And then when that doesn't go away and it's a chronic or a toxic level of stress,
Is that
then
stress, the toxic level is when you're living with somebody who's toxic?
it can be. It can be. Or it could be, for example,
Situation or school situation?
or for example, if a child, I always think of in terms of children, forgive me, but if a child has an alcoholic parent, anytime they hear ice in a glass clinking, they think they have this dread and their cortisol starts going up because they know that it's going to go down a path, right? So anytime they hear ice clink, that could trigger a cortisol response, even though it has nothing to do anymore as an adult with that. So it's a very subjective thing. But it's that toxic level of stress that your body sees, that it's that cortisol response that is sustained rather than a short burst as it was meant to be evolutionarily, that then impacts our physical health and our mental health in a lot of ways, but also we know in kids it interrupts developmental processes. Right, so when we talk about ADHD being on the rise and certain things, right, certain emotional and behavioral issues, a lot of those things we're now understanding in terms of the epigenetic phenomenon of toxic stress and trauma in kids. So it's super important to understand these things and to build resilience as much as we can and help. And that's kind of where I'm at. I feel like at a point in my life and my career where I can kind of look back and kind of appreciate the synchronicities that have happened and how it's kind of all led me down a path, not really knowing where I was going at the time, but it kind of all makes sense from where I'm sitting now when I look back. And my interest in pediatrics, having gone through what I went through, doing my child abuse fellowship really informed and gave me a lot of tools to understand a lot of the trauma-informed care, the trauma work and resilience and all that. And so where I am now is how do we promote that healing? And that's why I asked you that question, because I think healing needs to happen for everybody. We've all just gone through some collective traumas as a society, and we're going to continue to. And in addition to the individual ones that we all go through, and so we need to sort of come together as a community in terms of, compassion, but also like building resilience as a community and really fostering that. And any way healing can come, right? So, I absolutely am a strong advocate for therapy. I talk about therapy all the time with my kids and say, it's like you're carrying a backpack of like rocks and they're really heavy and it's weighing you down. And once you start talking about them, what those individual rocks represent, because some of them are yours to own and some of them are not. You're just carrying them around. And so once you start talking about it in therapy, you can start unloading that backpack and it starts feeling lighter and you kind of start opening up your chest and you can breathe a little bit more deeply and it just feels different in your body, right? Like the trauma actually resides in your body and the healing has to happen there. And so
do you think that children today have harder lives and worse trauma than us or our ancestors?
Right.
Or in a way, is it just different and it has all the abuse has shifted online?
So I don't know that I can fully speak to that, but what I can say from what I've witnessed just in the 17 years of doing this, that I feel like the kids now, a lot because of social media and what that brings to the table, and it's a whole new way to sort of feel inadequate, the Instagram lives and the whole new way of bullying and all sorts of things that can happen on social media that were not there when I first started off my career in pediatrics. And so I've seen a shift just from that span of my career so far. So I can't speak to generations, but what I can say is this, is that sometimes can be a tendency, and we do it, also in the medical field, that the residents these days, they don't have it as hard as we did. We used to be the only ones that, like, all that. I used to go to school backwards in the hot sand barefoot, and all those kinds of analogies, right? We have that tendency. We're human.
My pain is worse than yours.
Yes, I've been through more. Yes, exactly. And some of that may be true, but a lot of it is also, the danger of it is discounting what it is that kids, young adults are going through now, and really just trying to understand it and to ask them, going back to asking questions and going back to, how does that impact you? And where does that feeling live? Like when you feel nervous, where is that in your body? And what can you do with that? And what does it feel like? And what makes you feel better? What makes you feel lighter? And is it listening to music? Is it talking to someone? And also a lot of this is taking away some of the stigma and the shame, right? Like, especially with kids, but even as adults, we think that, we're the only ones going through something, and the shame or the embarrassment, the stigma of it, may lead us not to even share it with our closest friends, and once we do, that lightness, especially if it's the right person, right? You got to choose wisely. Not everyone's deserving of your light. Yes, exactly. It's got to be a safe space. But
you can only heal in a safe space.
Right.
You are with frenemies or with toxic people, they're not going to help you heal.
Right,
So
right.
first, like,
Choose wisely. Right.
yes, for sure.
Right. But once you do, and it can really, that connection through the compassion, right, is, it can be so healing. And that's what I think we need to foster in any way, shape, or form,
So tell me one other thing that I wanted to ask. Have you come across like any specific problems with kids? For example, kids who are gamers, for instance. Like I have some ladies who work for me, and their kids are like always on some tab or something. Do they have like a different kind of anxiety problems? I mean, they have attention deficit. Like, why is the attention span shortening? And does that have? Is that ADHD, or is that just we have caused it in our people that they can't carry a thought for more than like 6 seconds?
So I don't know. It's a good question. I'm trying to.
Would you tell like a teacher that don't allow your kids to bring in phone?
I mean, I think I think it's nice when I am able to disconnect from my phone. I cherish it.
I want my phone to be implanted in my ear so I can just like.
There are days where I want to throw the phone in the river. But it's, like if I'm away on vacation and it's a lovely thing to be able to disconnect. You can't disconnect completely in this day and age. There's just no way. But yes, like having the ability to not have to look at your phone every 2 seconds in order to feel seen, right? To really connect with the people in front of you and be present. I mean, I think that is what we're missing, that, because we're constantly looking at our phones, we're not present in the moment. And I think that is leading sometimes to a feeling of loss of connection, and that can snowball depending on what the resilience is. The particular milieu of what's going on in that individual person, how they handle that. But like, I think it's not the kind of connection that sometimes it can be great, right? Like during pandemic, Zoom was wonderful. The phones were great because you were like able to connect when we couldn't.
Without getting together.
Right, exactly.
That is, I heard a word which I wasn't aware of. It's called fubbing, which is like snubbing, but with your phone. So if you're like on your phone while you're sitting with your mother, you're fubbing your mother.
See, I didn't know that. I learned something every day. Look at that. You taught me something. Said you weren't a good teacher, but you just taught me something.
I'm not a good teacher because I have zero patience with everything. I'm a very good learner. I sometimes wonder, like, if somebody comes to me and asks me the top 5 things to do or not to do, I always have that. Like whether it's like an anti-aging or I'll be like, you've got 1, 2, 3, 4, 5. These are the 5 things you should do. Do you have something like that for your kids?
I don't, but now I think I might try to develop that. I do think that, staying present and, when you're sharing a meal or something with somebody, to kind of stay there and just be, how long is that really? 20 minutes, half an hour if you really chew slowly. It's not a long amount of time, but just, and I think that will build the social skills also, of being able to sit with people and ask them questions and have conversations like these that are, totally impromptu and just, let's see where it goes, and not having to be prepared and know everything ahead of time, right? So
you can never know everything, and especially when you prepare too much, it seems like you're crafting a movie or something. And that I like life to be
spontaneous,
real, and that's what it is, and that's my effort, and that's why I like to hang out with smart people, because I want to absorb, I want to learn more.
Me too.
That's the thing. But so pediatrics I always considered that pediatrics to be hardest of all specialties, because you just have to connect with a human, which is not a fully formed human, and it's in the process of being formed, and you as a parent or as a teacher or as a friend or of the family, you're basically taking care of, you don't know what the trajectory of it. And I don't know how to prevent mental illnesses in rapidly growing AI fields, like where there is artificial intelligence, where there is going to be chatbots that will chatbots become, is it going to be different for our children? I mean, how is it going to impact them?
I don't know, but hopefully I'll still be doing this to, be able to mitigate any harm, and kind of study it and be there as, as a protector, and try to understand it and contribute to that, so that we can make sure that our kids are growing up in a safe, healthy environment. And I have one thing that I have to say is that they are fully formed individuals, they're still growing and developing, but they do have, and you have to, and I think that's the,
when do you
that's
think
the,
a child is fully formed?
well, it's not about,
So believe in plasticity.
so I think that's what pediatrics and pediatricians do so effortlessly a lot of the time, is that you have to meet people where they are, right? That's true in life too. You have to meet people you have to meet your children, your patients where they are. You have to meet your parents where they are, right? And that's the thing about pediatrics that is perhaps more challenging. It's not just the patient, it's also the parents that you have to kind of get on board, and a lot of the time spent is in that relationship. And I love that. It is such an honor, and I mean this so sincerely, that people bring their most precious They're beautiful children to you to take care of. Like, what is more? That's such a big responsibility, but it is such an unbelievable honor that someone would trust you with that. And that's what we do. And that's what I think in pediatrics, you navigate that. It's almost, it can be effortless, but you do it, you shift from patient to patient. Every room that you go into, you have to kind of modify your style based on who it is that you're dealing with. And that's true for all of medicine, right? Like, you go in as a family medicine doctor, in the anti-aging, you have to kind of adjust your approach to the person who you're meeting there today. And so
I tell my patients, I'm like, listen, your doctors are like shoes. You have to find your right fit.
That's very true.
We serve you, but you have to find your right fit, and not everybody's going to be your cup of tea. And
yes,
and because you have to find the person who can relate with your experience.
Absolutely.
And that's the only way they can heal you, because it's not just like us throwing a medicine at you, right? So, well, thank you, Neelo. This is so nice. My next time when you come to me, I'll be asking you about what are the top 5 things that you want me to tell somebody with a child.
I'll have to think about it. I'll come prepared.
And does it and can it change with like what age group this child is in?
Absolutely. That I know for sure. It would change based on the age of the child.
Really? Mm-hmm. So can you tell offhand, like, what about like somebody like me if I'm a child?
No, I'm not allowed to. Adults who are still acting like children, like me. But I think what I do tell children of all ages is to know who you are and use your voice. You have an opinion, you have thoughts, you have a voice. Don't be afraid to use it. Be your authentic self, whatever that is, whatever that means. Do that. Find the people around you who can make that feel safe, and keep those people around you. Shine your light brightly on this world, because we need that healing. That's where the healing comes. When you do what is authentically yourself and meant for you to do on this world, you will have healed this world a little bit. And we all need that. We need the healing to come. And so surround yourself by people who rejoice in your light, who don't dim your light, or who you don't feel like you have to dim your light to be around. Those are the things that I say those words to kids of all different ages. I don't know if those are 5 things. I lost count, but those are a few things that I say.
That's really cool.
Thank you.
I think even adult medicine should tell nice things like that. So one other thing. So why did you do MPA? Like, I see that you've done pediatrics and stuff. What was the thing with Masters in Public Health?
I think pediatricians in general are also all public health people too, because a lot of what we do is anticipatory guidance, right? Like, your child's about to crawl, you're going to do, you're going to childproof your home, and you're going to do this, and you're, like, it's all anticipating things and trying to prevent them from happening. Vaccines, one of the, and clean water, those are the 2, most successful public health programs that we've ever had to date. And so I think instinctively pediatricians are self-select and are public health people in general. But for me, it was really understanding. I always kind of wanted to combine my fellowship experience in child abuse and use my public health knowledge to maybe work for, establish an NGO in terms of victims of child trafficking. But also just, it's a totally different episode. But
that episode where we'll be talking about that, because crazy that thing with the new movie. Have you seen that movie?
I haven't yet. I haven't. But it is something that is definitely on my list, and it's something that we've actually known in this field for a while. But that also more generally now has morphed into just increasing healing and the resilience of our communities and our children and the families. Because in order to teach our children how to be more resilient, we have to know how to do that too. We have to learn it as adults. So if we haven't learned it, we have to all heal. So that's sort of my my mission.
Who organize to wage war, they can only be stopped by people who are peacemakers, makers, and healers. They have to organize even harder for to not happen.
Absolutely.
Let me see if I have any questions from here because I see some comments here. Well, somebody was asking to join, and one of the questions that somebody has asked is that do you what supplements as a pediatrician, would you recommend to a teenager, and do you recommend Gardasil vaccine to young children?
So I'll take that in two different parts. So the supplements to the children depends on the child and what their health is, but and what their diet is, right? Like I really do believe in good nutrition. You know, that old adage of you are what you eat. I think nutrition is the best supplement that we can have. So if your diet is good and anti-inflammatory and you have good veggies and fruits and all the things that we know to be true, but also like minimizing the sugar and all the inflammatory stuff, that stuff really does work. I think that is the first place to start. And then depending on the child's individual needs, but, you know, depending on if it's a teenager who's having her period, who's a female, who, you know, like then a supplement like a multivitamin with some iron generally is a good idea because there's only so much bioavailable iron in what you eat, even if you're eating spinach and broccoli and good vegetables and stuff. So that's something that definitely I would say to bring to your, you know, child's pediatrician in terms of what specifically are the health challenges, because there are some chronic illnesses that children have that they may need certain things more than others. The second question of Gardasil vaccine, I do recommend it. It is offered as early as 9 to 11. I offer it starting at 11 years of age, and I leave it up to the parents in order to decide, you know, when exactly they feel like they want to have it. If you get the first shot by age 14 or younger, it's 2 vaccines. If it's 15 and older, it's 3 vaccines, 3 shots in the series. It is, you know, definitely anything that prevents cancer, which this does, I'm all for, also as a cancer survivor, but just in general. And it is safe and it is not linked to infertility. If it were, we would not be able to offer it. We cannot give, as physicians, we cannot give anything that does harm. And the scientific studies do not link it to that.
You recommend it for both boys and
Absolutely, yes.
girls?
Yes,
I think that everybody should have it,
absolutely.
and even adults. And I many times recommend it to my clients. I say that even if you're an adult and you have to pay it out of pocket, just do it, because insurance companies may not cover it because then they'll have to like cover the entire population, and that's too much money. They're probably cutting costs. Neelo, I love you. I have so many more questions, and I do see that our friend is outside
Oh,
ready to.
make us some tea.
And also, it's time for massages and stuff. But I would for sure have you back where we
Oh, thank you.
about your
So many things.
you healed yourself from something so important that happened to you, and that life event that changed your perception of self and how you took care of yourself and how it has impacted you. So that's my next session with you, and
I look forward to it.
you know, I'm going to put myself on your calendar at the end today, and I hope that people will, you know, anybody who has any questions after listening to Dr. Neelo today, please comment, and when she has enough questions that she wants to answer, we'll.
It's been an honor. Thank you so much. Thank you.
I'm going to log off, and then we'll go and party. Then the real party.